Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class health care provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. Soldiers recovering from serious combat wounds, injuries, or illness receive excellent medical care in our treatment facilities while they receive military leadership and support from their warrior transition units. But there are so many roads to recovery. Some veterans, including soldiers assigned to the Warrior Transition Brigade National Capital Region, are working towards recovery by showing their resilience on stage.
We started about a year ago, and Shakespeare was new to not all, but most.
Let him knock till it aches!
I have never acted before. This is my first time.
And afterward consort you till bedtime. My present business calls me from you now.
I originally wanted to sit and observe, and our director encouraged me highly to participate.
Quiet off stage and get ready for Act 1, Scene 1. Off you guys go.
One day, the director just said, give it a shot. And I was like, no, I'm not going to. I can't. I have not only PTSD, but a lot of other stuff going on.
Your wife's her name.
Well, I actually have post-traumatic stress disorder and compassion fatigue, as well as a back injury, and that definitely takes away on motivation, takes away on the desire to do a lot of things that I normally would do. I've had the opportunity to get in with the 12 castmates that we have, and that has helped me reignite my passion for acting. I'm actually enjoying this immensely.
In any type of performance, there's some real vulnerability. I find that to be kind of sacred when trust is put into you in that way. So to me, I find that to be very special.
I walked into this thinking, I can't. Not good enough. I can't remember stuff. I forget what I ate, like if I even ate breakfast. I forget to take my medication. I forget everything. There's no way I'm going to remember an entire play worth of lines. It's impossible.
My job has just been about unleashing some of that talent and watching it grow. That's really what you do in this work. So teach them a few very basic tricks, they take it from there, and then as a group, they build that camaraderie, they support each other, and you see the production coming together.
Ow! Ow! Ow!
The challenge would definitely be the language.
Acquainted with his fits, on purpose shut the doors against his way.
It brings a lot of depth and humor and character to the audience.
What needs all that? And a pair of stocks in the town?
When you're out there, the words flow out of your mouth. You're not saying them, they're coming out.
It's the most rewarding work I've ever done.
My business cannot go this down. I'm
Here more for being a part of the camaraderie and a part of the production, and to keep myself engaged in the art of acting.
The emotional help that it's brought me, unexplainable.
Stage performance is just one of the innovative ways wounded, injured, or ill soldiers are recovering. From art therapy to adaptive sports, soldiers in transition are demonstrating that persistence beats resistance. We often show you scenes on this program of doctors, nurses, and medics providing world-class care to patients. But there is another side of healthcare, and it's no less important. 2 Regional Health Command Atlantic staff members were recently recognized by the Army Surgeon General for outstanding logistical support.
Haran Siva and Joseph Florence are 2 of the top logisticians in all of Army medicine. That's according to the Surgeon General, who selected them for the 2015 Professional Medical Logistician Civilian Awards. Regional Facilities Director Siva won the supervisory level category. He's an expert on health facility planning and is the driving force on building repairs and modernization. This is crucial in providing first-class health care.
If a facility doesn't function the way it should, then that means it has an impact on the ability of the clinic or hospital to provide services. So part of their functions of a facility manager at an MTF is to make sure their mission can go on, and any disruption is anticipated and solutions are planned ahead.
It's also crucial that providers have all the tools necessary to make great health care possible. Florence keeps an eye on the little things that together have a major impact on mission accomplishment at the regional headquarters. The value can really add up. He's issued over $2.8 million in automation equipment like computers, monitors, and peripherals.
I'm happy doing this. Keeps me busy and get things done. Everybody's really good to work with.
With Siva and Florence keeping an eye on the big picture, while also tracking the individual needs of staff members, medical logistics support is helping keep the region's health services professionals supplied with everything they need to provide world-class health care. Only 3 civilian medical logisticians in all of Army medicine won this award. For the Regional Health Report, I'm Jerome Banks.
In other awards news, the Army Wellness Center at Fort Drum, New York was recently honored with a Certificate of Outstanding Performance by the Army Public Health Center. Army Wellness Centers, like the one at Fort Drum, provide weight management assistance, biometric screening, health assessments, and exercise and metabolic testing. The center has met or surpassed daily visit goals since it was established 3 years ago, helping thousands of Fort Drum community members in the process. And finally, there is a new beneficiary feedback system available to beneficiaries to rate the service they receive at each of our military treatment facilities. It's called JOES, or the Joint Outpatient Experience Survey. The old survey system, the Army Provider Level Satisfaction Survey, called APPLES, phased out last month. JOES is a common survey that will measure and improve service across all of our military medicine to improve the quality of service. And that's the Regional Health Report for August. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.